Hi everyone, welcome to my YouTube channel. I am Dr. Rajiv, specialist in physical medicine and rehabilitation. Let us begin solving these MCQs.
This video deals with the questions regarding splints commonly used for treating hand disorders. As you all know, questions from the topic of hand splints are quite common in most of the competitive examinations. So let's review some important hand splints. The first question is, which one among the following pairs is correctly matched with respect to the image shown below? A. Knuckle bender splint, ulnar nerve palsy. B. Knuckle bender splint, median nerve palsy. C. Dynamic cock-up splint, radial nerve palsy. D. Turnbuckle splint, Volkmann's ischemic contracture. Take a good look at this splint. Another view from another angle. The correct answer is dynamic cock-up splint, radial nerve palsy. Suppose we don't have much knowledge about this splint or its uses. Even then we can pinpoint the correct answer by analyzing the question and the choices given. Let us see how it can be done. The dictionary meaning of the noun cock-up is upward curl or turn on top of something, just like a hat with the front portion raised. Cocked up, the phrasal verb in British English means messed up. Well, this splint with its springs, outrigger, etc. may look like a complicated appliance. On the splint shown here, you will see finger loops with the springs on the outrigger. Sometimes these springs will be replaced with rubber bands. There is an extension strip for attaching a thumb loop with a spring or rubber band. And you will see springs on the dorsal surface of the wrist region as well. So it is quite clear that the splint contains mobile components. That means it is a dynamic splint. Now we can come to the conclusion that this splint is supposed to pull up. That is, extend the weak fingers and wrist, an important action which is affected in radial nerve paralysis that results in wrist, thumb and finger drop. As you know, there are multiple causes for radial nerve palsy. Radial nerve palsy was referred to as dangles by Benjamin Franklin. Splints can be classified into static, dynamic, static progressive and serial static. Static splints are also prescribed in radial nerve palsy, especially for nocturnal use. Now I hope all these things are crystal clear to you. Static splints have no moving parts, whereas dynamic splints have mobile components such as springs, pulleys, rubber bands, etc. We have already reviewed a type of a dynamic wrist hand finger cock-up splint commonly used in the treatment of radial nerve palsy, characterized by wrist, thumb and finger drop. Static progressive splints have inelastic components to maintain the ROM, that is, range of motion of a joint, as close to its possible end range ROM. Typical example is a turnbuckle splint, about which we will discuss later on in the video. Serial static splints can be remolded and reapplied until the desired ROM is achieved. This is a little bit of technical detail about the applicability of these splints and a little more about static progressive splinting. This is another model of a dynamic wrist hand finger cock-up splint. As you might have noticed, here there are no springs at the wrist level and this portion is bent up. A strap and a buckle are provided here for wrist support. Outrigger springs and loops are similar to the model shown in the question. This splint is suitable for posterior interosseous nerve palsy, which, as you know, is a low radial nerve palsy where there is more of a finger drop than wrist drop. Even some patients with a high radial nerve palsy, such as that occurs at the humerus level with the typical presentation of a wrist, thumb and a finger drop, report better control of the wrist with this type of splint. Well, this may be a subjective opinion. This is a slightly different design. This is the splint shown in the question in action. Dynamic splinting plays an important role in the rehabilitative care of radial nerve palsy. The force components and articulations of this splint provide constant low load that exerts controlled mobilization, producing passive extension of fingers and wrist. A dynamic splinting permits active exercises for the finger and wrist flexors. In contrast, a static splinting provides only a support to the wrist and fingers, and no mobilization is possible here. This will give you an idea about the meaning of outrigger in different contexts. This is a highly versatile splint, good design indeed. The outrigger component of this splint can be detached. With the outrigger removed, this dynamic cock-up splint keeps the wrist passively extended and permits active flexion of the wrist and finger flexors, but passive finger extension is not possible. This splint may sometimes be used in the rehabilitative care of radial nerve palsy as part of hand therapy. A common consensus is lacking regarding the indications for splint use. The protocol differs from facility to facility. However, it is generally used in the conservative or non-operative management of RNP. For instance, in cases of neuropraxia following Saturday night palsy, or due to iatrogenic causes where only neuropraxia is suspected. This splint may also be useful during the postoperative rehabilitation phase following nerve surgeries or tendon transfers. Another specific use is for strengthening the flexors and keeping the hand joint supple in cases where a tendon transfer is planned. However, while planning the rehabilitative care program in radial nerve palsy, it is better to give progressive resistance exercises to the flexors and pronators as well, even from the initial stages. This would help if a tendon transfer becomes necessary at a later stage. It is better to remember that use of splints and home exercise program are only some components of the rehabilitative care of radial nerve palsy. Let the patient undergo a comprehensive rehabilitation program until full recovery. A definition of splint. A splint is an external supportive orthotic device. Since a lot of questions are being asked from this topic, try to visit the Department of PMR in your college. You will find different types of aids and appliances in the P&OS wing, commonly referred to as the Artificial Limb Fitting Center, or in the Occupational Therapy section. This is very important. Orthoses is an externally applied appliance to an existing body part. Examples include splints, braces or calipers, corsets, lumbosacral corsets, etc. Here you will see different types of orthoses such as lumbosacral corset, spinal brace, limited motion knee brace, ankle foot orthosis or foot drop splint, and short air ankle walker boot. In contrast to orthosis, prosthesis is an artificial substitute to a missing body part. Now I hope it is clear what exactly are prosthesis and orthoses. He is using a lower extremity prosthesis for ambulation. This is a prosthetic hand. Don't get confused this with an orthosis. Let's now briefly discuss about static cock-up splints. These are most commonly prefabricated with malleable aluminum or low temperature thermoplastics, have a soft padding with ethylene vinyl acetate, and the velcro straps fixed with metallic rivets or glued to the splint. Thumb can be positioned comfortably on the splint. If the splint is made of malleable aluminum, the wrist extension can be adjusted to 10, 20 or 30 degree just by manual pressure. These are its uses in clinical practice. This is a commonly available splint made of malleable aluminum, but there is no thumb support. A static volar cock-up splints have only limited role in the treatment of radial nerve palsy. However, it is generally advised while sleeping. Dynamic splints shouldn't be advised during sleep because the projecting parts might injure the hand or the body. A few words about resting and functional position splinting. There is a lot of controversy regarding the resting position splinting. However, the hand must remain comfortably in the resting position and a first wave space contracture shouldn't occur. Now let us briefly discuss about some wrist support orthoses, commonly referred to as wrist forearm braces, which are basically static wrist cock-up splints with metallic or sturdy plastic inlays for support. These are commonly used when a sturdy splint with mild to moderate wrist support if required, for instance after removal of POP or fiberglass cast in the treatment of fractures around the wrist. This leaves the fingers and the thumb free, permitting room for functional activities. These types of splints usually will have a metal or a sturdy plastic strip inside this pouch. If it is made of malleable metal, the angle of cock-up can be adjusted with manual pressure. This splint may be useful in the conservative management of carpal tunnel syndrome, where the wrist can either be kept at a neutral or in 5-degree extension. These are included here just to give you an idea regarding how functional training is being carried out. Okay, let us now see what's a knuckle bender splint, one of the choices given in the question. All of us are familiar with MCP joints of our hand, which are commonly referred to as knuckles in layman's terms. Of course, the other finger joints are also called knuckles, but knuckles generally mean MCP joints. So, we can infer that this splint is meant to flex the hyperextended knuckles, and the splint shown in the question did not look like something meant to bend the knuckles. Ulnar, incomplete or partial claw hand is characterized by hyperextension of MCPJ. Please note it is hyperextension of MCP joints and flexion of PAPJ and DAPJ of the ring and little fingers, the result of ulnar lumbrical weakness. Knuckle bender splint is a dynamic splint which helps in flexing the hyperextended MCPJ and keeps the flexed IP joints extended. The second to fifth fingers are kept adducted in this splint. This is a different dynamic knuckle bender splint design. Here only the MCP joints of the ring and little fingers are splinted. Total claw hand results when both ulnar and medial nerves are involved. This splint, as you can see, has a dynamic attachment for a thumb opposition and a palmar abduction. The dynamic knuckle bender splint shown before also can be used in this condition. This type of static splinting is known as MCP hyperextension blocking splinting. Low temperature thermoplastics can be molded to the desired shape and remolded, all by immersing it in a water bath at 60 to 70 degrees centigrade. These are the classical signs of a median nerve palsy: ape thumb, pointing index, and hand of benediction. An opponent splint is sometimes prescribed in median nerve palsy. One of the choices given in the question was turnbuckle splint. This is a turnbuckle. This is used for traction or distraction, as the case may be. Nothing like this is seen on the splint shown in the question. So it is easy to spot the correct answer. This type of splinting is sometimes used to improve range of motion in cases of contracture of joints such as elbow or a knee, and some rarely wrist. In VIC, there is contracture of the flexor muscles of the forearm, wrist and fingers due to ischemia secondary to neglected compartment syndrome. Volkmann's ischemic contracture is a late sequelae of acute compartment syndrome. A Volkmann's sign. Passive extension of the fingers at IP and MCP joints is possible only while keeping the wrist joint flexed. This is Stuge's classification of Volkmann's contracture. According to this classification, there are mild, moderate, and severe types. Splinting, physical therapy, and occupational therapy may be indicated only in mild cases. Sometimes surgical procedures may become necessary in these cases as well. Moderate and severe cases require surgical correction. I think now it is clear that just by analyzing the question logically and applying our knowledge, we can easily spot the correct answer. Judicious use of splints and other types of orthoses are very much important and relevant in clinical practice. The ancient concept for absolute immobility for splinting has evolved into controlled mobility and as a means of betterment of function in the modern era. To understand the present, view the past, how apt it is. A salute to the great visionaries who have contributed a lot to the field of prosthetics and orthotics. Let's end this video here. Thanks for watching this video. If you like it, please give a thumbs up. Feel free to share it and subscribe to my channel. Bye.